So one of the most common questions we get is chiropractic safe for children? Hi, I'm Edmund Rodgers. I'm the principal chiropractor here at Relief Chiropractic Health Clinic. And today we're talking about kids getting chiropractic. First of all, let's talk about safety and let's talk about the adjustment for children, because the assumption would be that the adjustment for children is exactly the same as the adjustment for adults, and it's not. We use completely different techniques, completely different amounts of force. It's often very, very, very light. We can adapt what we do to the patient that's in front of us, whether it's a baby, where you might do some releases under the head, into the muscles, into the fascia, all the way through to a teenager, all the way through to an adult, to a geriatric patient. So it doesn't matter who we see, we adapt our technique for the person in front of us. And there is absolutely nothing to say that chiropractic is anything but beneficial for children. We see babies. I saw my own daughter for a check when she was about 15 minutes old, so I'm more than comfortable. I'm sure all of us are more than comfortable with seeing children and babies. Now, why might a child come in for care? It might simply be that you know they've been through something. Birth is a big trauma. You get a lot of twisting of the neck, you get a lot of pulling during that birthing process. It's the first thing we go through as humans. It's also one of the most traumatic things that we go through. It's obviously traumatic for mum, it's traumatic for baby as well. The other thing, of course, is that as you grow, as the baby grows, they go from lying down to crawling to walking to running, and there are falls all the way along the way. There are developmental stages throughout that process, and you need your spine to develop and change from a C-shaped spine to the usual curves that we see in an adult or in someone who's walking and running. It's really good to see a chiropractor to make sure all of those steps happen properly, to make sure there isn't some sort of developmental thing going on. And the other thing, of course, is that as babies become kids, kids become young adults, they're interacting with the world, so their posture is changing. They might be wearing bags, they might be on screens. They're going to be using their body completely differently throughout their childhood and throughout their life. So chiropractor's there to help them navigate that and to make sure nothing's creeping in. So what are the sort of things we see improve in babies and children? Well, babies come in sometimes with things like colic, sometimes with distress, sometimes with crying. And we often do see that improve. Now, I'm not saying that we have a cure for every type of crying, because there are many different reasons for it. But birth trauma, stress on the spine, maybe an inability to turn their head, really common things that we see in practice. You often see as well, posture and the way that they move improves. I've had kids and babies that haven't been able to walk that are suddenly able to walk. It's not because we've performed some sort of miracle, it's because we've removed the stress that was on the spine that was limiting their growth, limiting their development, and that means that they weren't able to adapt as they normally would into that next stage of growth. When you take away that barrier, that thing that's stopping them from developing, you can see some amazing things happen for that child. Here's the thing. A lot of people would say, well, my kid's fine. But children don't tend to tell their parents that they have a slightly stiff back or that they've got something that's slightly painful. It's often hard for them, especially babies, to articulate that to their parents, and their parents wouldn't necessarily even know where to take them anyway. There's nothing wrong with coming in and having a check. The way I see it, seeing a chiropractor as a kid is exactly like seeing the dentist. We've all got teeth, so we all go and see the dentist, right? Well, I'd say the same's true with kids, with babies, with adults. What's wrong with getting your spine checked? What's wrong with having a little look at things? You might not want care for their whole life, but if you can periodically check in and make sure that things are right, then that would be wonderful. And we'd always be very, very grateful and very honored to see your babies, your kids, if you're open to bring them in. Anyway, that's enough from me. I appreciate you all. Let us know if you have any questions about treating babies, treating kids in chiropractic care. Thanks.